The first and simplest investigation for patients brought with reduced urinary output must arguably be a bladder scan to ensure the urinary outflow tract is not obstructed, for example by an enlarged prostate. In a clearly septic patient, you shouldn't wait for a diagnosis before starting treatment. For example, if you have a patient with abdominal pain and features of sepsis, you don't have to wait for a CT report before starting treatment for possible abdominal sepsis. For a reasonably stable patient with a traumatic hemothorax and an active bleed on their CT scan, it may be worth talking to a thoracic surgeon before inserting a chest drain. At any point, if the patient's breathing is compromised, the hemothorax must be immediately drained. Take the patient's past medical history seriously when treating, admitting, or referring them. For example, antibiotics in patients with myasthenia gravis may precipitate respiratory failure. Patients with Parkinson's or heart failure cannot afford to miss their medications. So, write up those drug charts. Giving too much naloxone too quickly to patients with opioid toxicity can result in severe agitation or other complications. Go slow. In unwell patients with acutely deranged liver functions, consider the possibility of paracetamol toxicity, even if paracetamol levels are normal. Other patients with acute derangement of liver enzymes will require urgent diagnostic ultrasound and hepatitis screen. In collapsed patients, pay particular attention to the QT interval and look for conduction blocks. Consider the possibility of Takotsubo in patients presenting with chest pain after a stressful episode. When starting an insulin infusion for any reason, ensure potassium-containing fluids and dextrose are also prescribed to be given when necessary. The last thing you need is iatrogenic hypoglycemia or hypokalemia. Consider the possibility of acute mesenteric ischemia in patients with atrial fibrillation who present with abdominal pain. Also think of acute limb ischemia if they complain of limb pain. Current anticoagulation does not exclude either pathology.